All right, why is it that most physicians pretty much suck at lifestyle-related issues? And because a lot of them, they can't even figure it out for themselves. Most of them are, uh, as healthy as everyone else is, and which is not saying very much in many ways. And they're kind of lost when it comes to nutrition and some of the other things. Some are better than others, obviously, but as a whole, this isn't probably the best source of information. And many physicians will say that, we've tried lifestyle, back in the 1980s and 90s. And it just didn't work. It just didn't work, and therefore, we might give lip service to it, but we're going to put everybody on drugs instead. And this is, quite frankly, what physicians basically get paid for. I mean, this is why you go to a physician. You can go to someone else to get a lifestyle-related issue. So this is what separates them through medical licensing and whatnot. The power of prescription allows them this unique access to these so-called drugs that are going to, quote-unquote, save you. Now, that often isn't the case. You can see it with, the big push towards, putting everybody on drugs, whether it's a statin drug, whether it's a GLP-1 drug, whether it's, antihypertensive drug or any of those things, because this is what they've been taught. This is what the pharmaceutical industrial machine has taught them. And I was part of that system, for many years myself. And, this is the only thing you learn, and one of the real issues, and this is one of the things that we address really well at Revero, is that you don't have any resources. As a physician, if you want to influence someone's lifestyle, you can tell them about it. Hey, go do this, go do that. But you have no way to back that up. You have no way to ensure compliance. You have no way to keep people accountable other than, maybe seeing somebody once every 3-6 months. It doesn't work very well. And that is why, physicians get the impression that lifestyle doesn't work, because they just never give it a good effort. If you want to do something within the pharmaceutical model, surgery, you put somebody on pills, there's all kinds of resources for you to do that. There are millions and millions of dollars of resources at your disposal, whether it's facilities, or personnel, or computer systems ready for that. But if you want to do a lifestyle intervention, good luck with that. There's going to be no support. In fact, it's disincentivized in many cases. I can tell you with my experience with hospitals, it's not interested in that. They don't want to pay for that because it doesn't make them any money. Anyway, that's the reality. Check out Revero.com if you want support. Look, it's not easy. I mean, it's simple, but it's not easy in many ways. And sometimes you need that support. You need someone to guide you every step of the way, to keep you accountable, to keep you on target, so on and so forth. So if you need some help with chronic disease, give us a shout at Revero.com. Get a free phone call. We'll see if we can actually assist you. And then, hopefully we can change your life. Y'all take care.